Well, we want to welcome you again to another episode of Unfiltered, and I have some really amazing ladies with me today. We're going to talk about a very adult subject, so kind of forewarning before we get started. There will be a lot of references to sexual assault, but what we're going to discuss is definitely a needed topic to discuss, and the fact that we have people here in Burleson that are able to help anyone who has gone through a sexual assault of any sort really moves to the understanding of people that care for those who have been hurt. So, Beth and Cindy, welcome.
I am Dr. Cindy Burnette. I'm the director of the Forensic Healthcare and Violence Intervention Department for Texas Health.
Gotcha. Very nice. And Beth, what about you?
My name is Beth Maeker, and I am the Forensic Nurse Manager for the Southwest Division of the Forensic Healthcare and Violence Intervention Program at Texas Health. Cindy is my boss.
Oh, very nice. Very, very nice. So you're on your best behavior
I'm
right
going to
now.
try to be. Her hand is on my knee
yeah.
here. It will get tighter if I start misbehaving.
So tell me what exactly forensic science does. I mean, it sounds something like a CSI type of episode that we're getting into, but...
Really, forensic healthcare, there's all kinds of subspecialties of nursing.
Mm-hmm.
We are nurses, although I have a doctorate degree, I'm still a nurse,
Right.
And so under nursing, you have all these subspecialties. You have cardiac nurses, you have pediatric nurses, you have emergency room nurses, and over time, we've just begun to realize that nurses play a very particular role in the world of forensics, of protecting DNA. Even back, I'm an old ER trauma nurse, so gunshot wounds and stabbings and things like that. And over time, it just became known that we have a skill that is not going to only help the health of an individual, but also help our law enforcement agencies preserve evidence on that side
Gotcha.
to pull everything together.
Interesting. So you're taking someone in, and when we talk about the forensic health side of things, and Beth, we talked today. So we had our Johnson County SART meeting today, and you got to introduce and kind of talk about what you do, or at least what kind of things that the nurses in your area do. I was really just kind of drawn into this understanding of these exams that you have to do, especially in a situation for sexual assault, and how you are preserving you made a good point. You're like, we're not for or against, we're just evidence collectors. We exam and we look at the specifics behind it, but we don't make judgment calls. We just kind of gather the science. Can you tell us a little bit about that part?
Well, kind of going back to forensic nursing, a lot of people, and when we get into court, we explain forensic nursing a lot of time is where the world of nursing and the legal world marry, come together. So the exams and what we do as a forensic nurse is, as Cindy said, we are nurses first and foremost. So the health of our patient. And you will always hear us refer to them as patients because, like we talked about, as a forensic nurse, I'm a very neutral, unbiased party in the whole process of what happens. The health of our patient is the very most important thing. And in taking care of that patient to make sure that their body is healthy, and if it's not, here's what we need to do to facilitate healing. We can collect what you might see on CSI or Law and Order, the infamous, if you will, rape kit.
Right.
In my world, and a rape kit is totally different. It's the duffel bag you see in the back of a van, or that has the duct tape and the ski mask and the gloves. But everybody refers to her that when we talk about evidence collection, it's the rape kit.
Gotcha.
But again, the evidence, everything about that whole entire taking care of the patient can be considered evidence, if you will. DNA, some. But then what they tell us happened, their emotional state when they're talking to us about what happened, their fears that they express during the reported assault, in discharge and planning for them to make sure we're getting them to a safe place. All of that can be considered evidence because all of that is a result of what they report just occurred or just happened.
Gotcha. So let me kind of set up a scenario, because I think a lot of people, we've kind of talked around the issue, but we haven't really got to it. So a lot of times when you're called to into action, it's after someone has experienced a sexual assault, some sort of rape, or I guess I'm kind of dumb on the issue. I mean, what all kind of facilitates a sexual assault?
Or even a concern. We have
Okay.
a lot of patients who say, I was out with my friends. We went to point A, we went to point B. Everything was going fine. And then the next thing I know, I wake up, it's 5 a.m. I don't know where I am, or I'm home. I don't remember getting home, and my clothes are either missing or parts of my clothes are missing. So what happened to me?
Gotcha.
So they're still, like I said, they come in because they're concerned something may have happened to them.
Gotcha. Okay. And so when that happens, what's the first kind of thought process? A lot of people would say, if I'm raped and I experience this and I call 911, the police come and they get me, they're going to start this case. And I assume at some point that's when you're contacted, and you're known that this is somebody that needs an examination, and kind of take me through that whole process of how usually this works.
Well, I think it can be a lot of different ways.
Okay.
Because what we experience truthfully is when it first happens, or the thought of what happens, most people really pause. We see very few patients come forward, even in the first 24 hours. Often it's several days down the line. They've talked to a friend about, hey, this happened to me. Also, what constitutes sexual assault? It's not just penis vaginal penetration.
Right.
There's other types. It's any orifice that's violated. So again, sometimes, and there's all different ways to enter, I hate to say the system, but kind of the way it is, because truthfully, although you're law enforcement, Texas law says you do not have to report sexual assault if you're between the ages of 18 and 64.
Oh, wow.
So that really allows individuals that have been assaulted to come to medical first and at least start the process. At least really what we do, we sit down with them first and talk to them about their rights under Texas law,
Gotcha.
which is kind of why I have Beth saying that we're medical and law enforcement marry.
Right.
Because although we're medical, we have to know the laws.
Yeah.
So we really do sit down with a patient or a victim, a person, and tell them, okay, you've been sexually assaulted. Let me tell you what your rights are in Texas. What you have the right to. Part of that is reporting options. There's actually you have the right to not report, again, only between the ages of 18 and 64.
Gotcha.
Under that and over that is a mandatory report. And also if there's any kind of mental, physical disability that keeps somebody from caring for themselves.
Gotcha.
Then we have to report that as well. So they have that option to non-report. They have that option to report. So a lot of times they will show up at the hospital first because their first thought is, I just want to make sure that my body's okay. I want to make sure I don't have a sexually transmitted infection.
Right.
Pregnancy is always a concern. So there's many different ways they can enter. Do police bring them in, law enforcement? Of course they do.
Gotcha.
But a lot of them really, I hate to say wander in on their own.
Yeah.
But they do. They just wander in on their own.
I mean, it makes sense if you're not sure where to go. And I mean, seeing it from this side, since being on the civilian side of watching all the law enforcement around me, we talk a lot about that kind of that disconnection between law enforcement and the civilian population. And there's a lot of love. Burleson is an enigma in itself, in the fact that this community really supports its police department, but that's not always for every individual. And so some people see the police department as they see him as a foe, or they see him as something like, wow, if I call the police, it means it really is getting serious. I just want to. And that's where I feel a lot of times you're going to see people walk in and say, hey, something happened to me. Just want to get this figured out. And that's great knowing that you have that education, that knowledge to be able to say, hey, here are your rights and here's what you can do, and we'll help you if you want to contact the law enforcement, we'll get them here. We'll get things started, because sometimes it does take a helping hand or somebody to hold your hand through a situation
Or
like
it
that.
takes time for that person to process it.
Oh,
Because
absolutely.
the majority of sexual assaults do not happen by a stranger. Is what people think. It happens by somebody they know, maybe somebody they love, somebody they trust. And for example, I was a single mom for a long time,
Right.
with 4 kids. And what would happen if I reported my boss that sexually assaulted me? I'm not going to have a job.
Yeah.
At that point, I'm not going to be able to feed my kids.
Oh, wow. Yeah.
And so why would I report it? But with the non-reporting option that's out there, it allows somebody to come in and get the exact same exam that they would get if they had reported to police. And then that evidence that we collect is then packaged up and sent to the DPS warehouse anonymously, and they hold it for 5 years,
Oh, wow.
which allows that person to think more about what happened, maybe get in a better place.
Right.
And then they can report, and then it's not as much of a burden of proof, especially if there's potential DNA evidence located in that kit.
Gotcha. Oh, wow. No, I never knew that. I figured you go and here's where I would love to get more information, because in my brain you're going and it's just a quick, we're just going to kind of once over you, and yeah, you look fine, and here's have a good day, here's a lollipop or whatever doctors do. Explain to me what an exam is like. I mean, I know this is probably an intrusive question to ask, but I mean, really kind of take us through, if somebody comes in off the street and they say, I think I may have been raped, or I know I was, but I just need somebody to help me. Walk me through that.
Well, the first thing for someone to know is that they are in control. They may have experienced something where their consents or their choices were taken away from them. So when they walk in for this exam, we do not do anything without their expressed consent. And that consent is I've heard it called fluid, meaning they can withdraw their consent at any time.
Okay.
And so, that being said, there's a lot of parts to the a lot of parts to the exam that we can do. So that exam can take anywhere from 45 minutes to 3, 4, 5 hours, depending on what all the patient gives us consent to do.
Gotcha.
How, if the patient is having to take several breaks, because one part of the exam, which oftentimes can be the most difficult, is we will ask them to tell us in detail exactly what happened.
Right.
And so that can be very hard for them to finally say it out loud to someone. So you may be having to take several breaks. Maybe they have a lot of injury that needs to be documented. So anyway, like I said, that exam can take a little bit of time. Like, come in, we do a once over, and you're on your way in 45 minutes, or it could take an extended length of time. And so we explain that to the patient, because if we have a patient who comes in and they need to pick up their kiddos from school in a couple of hours, or they need to be to work in an hour or 2 hours, and I absolutely cannot miss another day of work, then we'll say, you know what, we've got some time, and we might get into this later as far as the time frame thing. So let's have you. We always hate to have them come back, because you risk the possibility that they won't come back.
Right.
But that they know that I'm could be here for quite some time.
Yeah.
So again, like I said, it just kind of depends on what all that they agree or consent to allow us to do for the exam.
Gotcha.
I was going to say, and part of it is that medical. They come in, we're going to look at their body. And it's not like normal ER.
Right.
If my eye hurts, they're going to look in my eye. They're not going to look anywhere else.
I gotcha.
But for us, we really completely do that head to toe, from the top of their head to the bottom of their toes, because we're looking for really up front, we're looking for medical issues. We
Right.
diagnose, or not really diagnose, but we find a lot of medical issues that the patient might not even have known that they had, that then we have to turn back over to the emergency room
Right.
physician to address. But also injuries and other things can be seen in places you would never think to look,
Right.
like in strangulation. You would think they have marks around their neck. That's not where they're going to have injury. It's
Right.
going to be in their eyes. It could be inside their mouth. It can be in their ears and on their scalp. But they also may have injuries that they, during an assault or in any kind of trauma, the endorphins and everything, the adrenaline that runs, they might have scrapes all up and down their back and have no idea that they're even there.
Gotcha.
So it's not just we're going to go in. People think sexual assault, I'm going to go in and I'm going to look at genitals and I'm going to turn around and walk out.
Right.
And it's not that way. There's really 4 parts to our exam, which is a complete medical history, a complete head-to-toe exam, our anogenital history, an exam, and then evidence collection if it's applicable. Just
Gotcha.
depending. Evidence may not be collected on physical biological evidence. DNA
Gotcha.
may not be collected on every patient. It all depends on the type of assault, how long the assault, when did it happen,
Right.
and that type of thing.
Gotcha. Wow. Okay. So you mentioned a little bit, and I was going to interrupt, but you're going so good. I didn't want to. And you say, well, if somebody comes in for this head to toe, and you realize something that's not related to this injury or this exam, a mole that doesn't look right. I mean, is that all of that is documented all the way through? So, gotcha. Okay.
Referrals made. We say when we talk about the anogenital exams, of course, that can involve an internal exam of the vaginal vault and the cervix. And for your audience members who are adult females, they'll be familiar with that with their well woman exams. But we may see something on the cervix that just it's not an injury as a result of what happened to them, but it's just something that needs to be looked at a little bit closer. So we may bring in the ED doc or
Gotcha.
say, hey, we need a referral, or maybe our patient is pregnant. We discussed on a staff meeting this morning about the pregnant patient, and they are at risk for a lot of other things. And so we might need to get an OB consult in
Right.
to make sure that the pregnancy is a healthy pregnancy. So
Gotcha.
there's a lot that goes into it. And I know TV paints it as, and all this is done in an hour. They come in and they
Yes.
swab, and then, but there is a whole lot more that goes into the exam. And to be honest with you, the collection of biological evidence is very, very low on our totem pole, if you will, if you
Okay.
ask any forensic nurse, because,
Health is number 1.
Yeah.
Yeah.
We're nurses.
Yeah. No, it makes
and
sense.
there's all kinds of explanations on how DNA gets where it gets.
So we talked a little bit. You made mention a little bit about the time frame. Inevitably, what we run into when we do these podcasts is we'll get the comment section that will tell us, how wrong we are about everything, because that's how comment sections work. But we'll get 1 or 2 that says, hey, this happened to me 10 years ago, 20 years ago. And sometimes it's, I wish my police department or the hospital I had gone to was doing this. And so it always makes us feel better, if I can use quotation marks around that we're at least showing that we're doing something that others aren't. We also get the other ones that say, I hid from this. I didn't go. I wish I had. Get those. But the ones that get me the most are usually the messages that we get that aren't on the comment section, and they're the half-page message that we receive, and it says, this happened to me, and this is what I went through, and thank you for speaking about this, because even if it was only 1 or 2 people out there that heard it, that made a difference in them, that it made a difference. And talk to somebody who maybe has gone through this, and they're in that situation where they're trying to think, do I need to go? Do I need to come? It was 2 or 3 days ago, or it was 2 or 3 weeks ago, or I'm still have questions. Is there a time frame? Is there a, I mean, obviously you would hope somebody comes immediately, because I would assume that's where you're going to find the most of the evidence and the help they can get. But what if somebody's scared and they just don't want to come forward, and now they hear something like this and they're like, maybe it's not as bad as I thought it was going to be?
My message to them, in the state of Texas, we have protocols, and as the an analyzation, that's not how you say that word, how they analyze DNA is getting more and more sophisticated.
Okay.
So when I started this back in 2012, we were like at 48 hours. Then it moved to 72. Then it moved to 96. And so now 120 hours. So in Texas, the protocol is within a 120-hour window is the recommended time to collect biological evidence.
Gotcha.
Now, there are a lot of reasons why we may expand past that 120 hours. Military goes out 7 days. But that being said, the one thing that I would want to get out to the community is please, please, please do not let that 120-hour time frame that you may hear discourage you or keep you from coming in for the exam, because we can test for potential STIs, we can treat for them. Maybe if you're continuing to have vaginal bleeding, we can see if we can figure out what's causing that. That history that we can get from you can be very helpful. And just as from a healthcare provider, let me make sure that your body is okay.
Yeah.
I think this morning I talked about a young girl who was abused from the ages of 9 to 11. It was sometime in that time frame. I saw her a couple of years later. Kiddos are kind of a little bit different, but she thought she could have been pregnant that whole time. And so sometimes it's education.
Yeah.
Let me educate you about your body. Your body looks normal. Nobody is ever going to be able to look at you. No partner, no physician going forward and be able to tell anything happened to you. If I can give you that reassurance. So again, what I would say is please don't let that 120 come in. We'll figure out all the details and all the specifics on should we do this, should we do that.
Yeah.
Come in and just ask to sit down and talk with one of us.
And really, that's just biological evidence, too. One of the luxuries of being a nurse is that we can go in and testify in a courtroom, and we're not held to a hearsay rule. So when we even take that history, and really probably 90% of kid cases have no biological DNA when they take them to court, because they don't often report till weeks, months, years down the line.
Okay.
Do they ever report the assault? But what goes into court is that history that person gave us. So even an adult, if they tell us what happened and we document it, we look at their body. Sometimes there could be lasting effects of it, especially if it was a brutal physical assault that went around along with the sexual assault. But we don't follow under the hearsay rule. So I can be subpoenaed to go sit in the courtroom and say exactly what that person told me happened during the assault. And nobody else can do that.
Oh, wow.
Because it's hearsay. And that may be the only time that those words are even entered into a courtroom. And we don't document like normal nurses. If you've ever read your doctor's notes, now everything's on my chart, so you can go read everything.
Right.
And you still don't understand what it says after you read it, because everything is medical mumbo jumbo. We don't document that way. Everything we learned in nursing school about documentation goes out the window, because we document in quotations from a patient.
So I want to go back to the example you talked about before. Mom, 4 kids, the sexual assault happens with the boss or something along those lines. So she's afraid to come forward because of what will happen. And she goes a year or 2 before telling anybody. She can still come.
Yes, she can still come, and we would recommend her get medical care. Now, at that point, I think that you can either not necessarily walk into an emergency room. We know costs are a huge, everybody knows what it costs to walk into an emergency room, but at least go to their primary physician and get testing. I mean, I think everybody should have that sexually transmitted infection testing just for their own sake,
Right.
if nothing else.
Gotcha.
And I would also say for an individual such as that to also reach out, and you may get into this a little bit later, the resources that we have here within Johnson County, the Johnson County Family Crisis Center, your victim advocate that you have here within the
Yeah.
PD, because then they can sit down and visit with them, and it maybe is a phone call to us as a forensic nurse to visit and say, okay, what is the best plan for this individual? Is it better for her to come to the hospital and we to the emergency department and we take care of her there, or do we have resources? Do we have a physician or that we could send her to make the best plan for her?
Right.
Because it's all about her or him. It's not about what's convenient for me or my team of nurses, or what's convenient for the law enforcement, what's convenient for anyone else. What works best for her? Because we are
Absolutely.
very here's about the only time you'll hear me say the word victim, because of what I do. It's always patient, but this is a very victim-centered, trauma-informed process. It's what does he or she need,
Gotcha.
regardless of our time frame.
And so, kind of to get into the resources and the local stuff, when we've had sexual assault cases in the past, and an officer is taking this, so we'll just use a rape as an example. In order for them to get a SANE exam, they had to drive the patient, we'll use that term, to John Peter Smith in downtown Fort Worth. And here, just in the last month, we've been able to have SANE exams start at Texas Health South here in Burleson, which is our wonderful little hospital that we have on the south side of Burleson, closest to Joshua. It's actually by the QT off of Wilshire on the south way down. Amber over there is just absolutely amazing. One of my besties that I can meet. She's really amazing at what she does, and she was very pivotal into getting this started. And I can only imagine. I can't imagine what it would be like to go through a situation like this, but I can only imagine that if something like this was to happen to my wife or my daughter or anybody that I loved, having them closer to have this exam rather than taking them to downtown Fort Worth, especially if they're alone, especially if they don't have anybody they can talk to.
Scary.
Or yeah, absolutely. Or it's even an officer showing up on scene because something has happened and they realize that this is going on. Then you have to take them in a police vehicle to John Peter Smith, and 3:00 in the morning at JPS. God love them. I mean, they're awesome groups, and they're amazing people and nurses and doctors over there. But 3 a.m. at JPS is different than 3 a.m. at Texas Health South. So tell me a little bit about how we got started down at Texas Health South.
Well, I think I'll go back to we started expansion at Texas Health in 2015.
Okay.
In 2010, Dallas was the largest county in Texas that had no access to sexual assault nurse examiners
wow.
at no hospital. So the Texas Health Dallas Presbyterian Hospital was the very first one in Dallas County, and it worked so well that Fort Worth soon followed suit at Harris Fort Worth downtown. But what we were finding was that you can't get this care in every hospital you walk into, which is most people don't realize that.
No,
you feel like
I
you
wouldn't
should
either.
walk into a hospital and you can fix my heart and you can fix my leg and
Yeah.
and you should be able to treat everything that's there.
Is that just because it's such a specialty type of thing for nurses to?
It is. It's just a very specialty type of nursing, and I want to say there's less than 1,200 certified sexual assault nurse
wow.
examiners in Texas. That's just is that Texas?
Texas.
I think in Texas.
Wow. Okay.
Yeah, we go deserts. I come from I stole Beth from Amarillo or from
Oh,
Mother.
hey.
I came from Odessa, Texas, and I was the only nurse for 17 counties, and that was not my primary job. I worked trauma.
That's a lot of nothing, by the way.
Yes.
I've been to Odessa, and there
and
was a
so-
tree. I saw it. It was amazing.
Yes.
It's one.
I didn't know what trees were in rain. When that stuff falling from the sky, I'm like, what is this? But Texas Health realized right away that they were having these other hospitals, whether it's from Cleburne
Right.
or, whether it was in Denton, call and say, hey, I have a patient I need to transfer. And then crickets.
Oh,
The
wow.
patient would never come. So I am very proud to be part of an organization that realized that we have to treat our communities. We can't wait for our communities to come to us.
Gotcha.
And so in 2015, they started an expansion where they went from those 2 hospitals to 11 different hospitals across 5 counties of DFW. But yes, I'm very glad that we were able to pull Burleson, the Texas Health Burleson
Right.
location, or Texas Health South, as I think is what y'all usually call it, to be able to supply those exams, because we get a lot of phone calls from them, and the staff there is awesome.
Oh,
I mean,
yeah.
even the physicians would reach out and call us and say, "Hey, I have this person here today. What do I need to tell them, or what do I need to do?" So the whole point is really to meet people where they're comfortable at, and truthfully, maybe somebody doesn't want to go to Texas Health Burleson. Maybe their mom works there or their cousin works there, and they don't want anybody to know what happened.
Right.
But again, that's a part of being trauma informed, is that they now have a choice. Okay, if you don't want to go here, here's other places. We can go to Cleburne, or we can go to JPS.
Right.
Here's other choices for you as well.
So
But
if
the whole point is for us to try to meet our community. My boss always says where they eat, sleep, and pray.
Yeah.
That's where they want to be.
Oh, yeah.
And that's
No,
what we want to do.
Absolutely.
We're Johnson County residents, both of us. We just happen to both live in Johnson.
Oh, that's
In
good.
Johnson County.
Very, very
So-
nice. So,
yeah.
with that, if I show up to, let's say, I show up to Hughley and with asking for an exam like this because something's happened. So, I assume Hughley's going to say, well, your options are a JPS or a Texas Health South or something like that. They're going to help you find that, or do you come to those hospitals? How's that work?
Hughley, we do not come to. Cindy has approached them, and there's a lot of it's a hospital system. So,
Gotcha.
but that's ideal for the hospital to say, here are your options. Realistically, what happens is if it's Hughley, typically they will call our transfer line. And they will say, we need to transfer the patient to Fort Worth. Well, what we will do is ask them, where does the patient want to go? If
Gotcha.
the patient lives in Cleveland, would they rather go closer to their home? No. Like you said, their mother's ex-husband's brother's third cut, whatever.
Yeah, exactly.
I don't want, or
right.
no, the last time I was there, I did not have a good experience, so I don't want to go back for whatever reason. And then we will tell them, okay, here are the patient's options, and we will meet them. And there are times when they've called our transfer line and we've said, well, and we list JPS as an option. Now, I can't facilitate that transfer to JPS, but that is an option that they can certainly go there. And like we were talking this morning, we are not competitors because unfortunately, like I said, there is more than enough business to go around.
Yeah.
And I will never work myself. None of us will ever work ourselves out of a job.
Yeah.
So the thing is to, like Cindy said, you meet the patient where they are and where do they feel most comfortable. Because to have an exam like this, to talk about this, you really need to foster as much as you can a safe environment. And if they feel safer at JPS, then let's get them there.
Right.
They feel safer at Cook, let's get them in there. They feel safer in Stephenville, they feel safer at Burleson South, let's get them wherever they feel the safest, because that's where they will receive the best care.
Yeah.
And where they can be treated, because again, we wish you could walk into every hospital and get this care, but it's just our physicians I think they're taught, especially emergency room physicians, I think they have to do like one sexual assault exam in their residency, which
Okay.
was 30 years ago.
Right.
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 or whatever. And it's so important to get the patient to the right place the first time, even though they don't know. So even if they go into another hospital that don't have services, they still have to be treated there. The triage nurse cannot tell them, no, we don't do that. You need to go down the road.
Right.
They have to go ahead and go through the process, and the emergency room physician see them and make sure they're medically clear, medically stable before transferring them. So now you have 2 hospital bills.
Yeah.
And a whole bunch of time, because we all know that you don't walk in and out of the emergency room in just a few minutes. You're
Right.
going to be there a minute or 2.
Yeah.
Just to say.
absolutely.
And just to kind of talk real quick, we talk about there's not enough sexual assault nurse examiners to meet the goal that we would like, that every hospital, every freestanding clinic has a SANE nurse, if you will, available. Our training, we don't get to just watch. I always, when I talk to new nurses, watch a episode of Law and Order SUV or CSI and go to your nurse manager and say, I want to be a forensic nurse. Our training really, and I'm very proud of our training and protect that training, takes a good 18 months to 2 years
Oh, wow.
to get all the education you need, and then you have to have clinicals, and individuals who are in the nursing world will understand clinicals and then what we call advanced clinicals, and to be proficient, to be able to be on your own to do these exams really does take about a good 18 months up to maybe sometimes 2 years.
Oh, wow.
So it's, again, this is something we are very specialized, and just we don't have enough of us.
No, and that was going to be my next question. As a lot of what this episode is going to be probably watched by are going to be nurses, because we'll kind of address it that way. And I've got a lot of nursing friends. And what do you say to someone who sees this and goes, I need to be a part of that. I need to get the training. I mean, I assume there is some kind of nursing coalition that you go, hey, call your XYZ nurse and they'll they'll know what to do. But how does a nurse that's watching this saying, I want to be a part of that, how do they start that?
The crazy thing is in Texas, to be a certified sexual assault nurse examiner is regulated by the Attorney General's office.
Oh, really?
Yes. It's not even regulated by a nursing organization.
Huh.
Now they have the Attorney General's office has, and the governor has listed basically Texas A&M and a couple of other organizations to really come down with the training and to regulate things. But call us, we'll hook you up.
Yeah. How's a Red Raider feel about Aggies running this?
We're both Red Raiders.
Oh.
That's what
And
we
there
were.
is, I'm going to have, and I don't know if this is allowed, but one of the most favorite radio stations I listen to in the morning is 99.5.
Yeah.
And they are predicting that the college football championship will be A&M versus Tech.
I would do that in a heartbeat. I love that. I love that.
And myself and Sonia, who's the manager on the Dallas side, and she couldn't be with us today, we go to A&M to help teach what we refer to as baby saints, and that's kind of condescending, but so I can stomach the maroon and white.
Okay.
But
All right.
I bleed red and black.
That is totally fine.
So yeah, we
Totally
still have to
fine.
meet everything required by the Board of Nursing because we are nurses.
Gotcha.
But they have nothing to do with our SANE certifications. There are a couple of organizations, the International Association of Forensic Nurses. They've done a lot for our field, and they
Gotcha.
put out. There is a test as well to be certified through them. Beth and I are both certified from them. There's only, I want to say, less than 600
Oh, wow.
certified throughout the United States, and we
Goodness
have
gracious.
about 15 on our team
Wow.
alone certified.
That's
through them.
amazing.
Yeah.
So, but if someone is watching or listening and they are in the nursing field and would want to visit with us more, feel free at the end or whatever, if you want to give them my contact information.
Yes, we'll put the contact info in the comments.
Yeah,
there.
we'll
Talk to
talk
them
to
about-
anybody.
Great.
And sometimes try to talk them out of doing it. Why do you not want to do this job?
No,
You know,
I get that. I get that a lot.
My husband hears, our husbands both hear our phones ring at 2 a.m. because an officer has called us, and I am always going to pick it up.
Yeah.
Or hey, I got to go to work.
Yes.
And
No,
see you later.
I
you
get
know.
that. My son's in the Marines. He's coming back next year, and he's like, Dad, I want to be a police officer. And I'm, hey, bud, I got guys that tell you all day long. And I talk to them. They're like, why didn't you just become a fireman, man? It's so much easier to sit around on the couch all day. I'm like, this is very true too. So, I get that. Well, ladies, this is awesome. I appreciate not only what you've brought, that's horrible English, what you have brought to the community, but just your passion behind helping people who are obviously in one of the worst situations of their life. And it takes good, loving people as yourself to honestly, you can feel it as you're talking to you that it's not an easy exam, but you would make it the best situation you possibly could, and that their health is the most important thing, that you're not worried about the politics or the one side or the other. You're just making sure they're okay.
And the one thing I think is important to throw in here at the end before we leave is the cost of exams.
Okay.
You know, because we did talk
Yes.
about money a little bit and how expensive it is. In Texas, the law is that a patient will not be billed for a sexual assault medical forensic exam.
That's awesome.
So there really is two portions of the bill when you walk into the emergency room. There is the emergency room portion and the portion that our team does. That portion across Texas is paid for. I will say Texas Health is probably the only hospital that I know that also assists the patient to fill out the crime victims compensation application. So they should never get a bill at all
That's awesome.
for sexual assault when they enter one of our hospitals.
And that's probably a deterrent in itself sometimes.
It's a huge deterrent, you know, for, again, if I'm going to pick between, you know, feeding my family or getting medical care, I'm going to probably feed my family.
Yeah.
It's just expensive, but that we never want that to be a deterrent at all, even for somebody coming forward. Either there's things that we can do to help with that
That's
on the
great
financial
information.
side.
I'm so happy you
That's a
said
good thing
that.
to add
Yeah.
to it. Yep.
Absolutely. Ladies are awesome. Thank you so very
you.
much.
Thank you.
Appreciate it. We'll
Let's do this again.
yeah, absolutely. I'd love to have y'all again.
We'll throw
This is
you more
great.
topics.